Imagine living every day with an invisible risk that quietly threatens your heart, your brain, and your overall health. That risk is high blood pressure, also known as hypertension, and it's more common than you might think. You may feel perfectly fine, but this silent danger could already be at work, gradually damaging your body without warning signs. In this video, we're uncovering the truth about high blood pressure, what it is, how it can harm you, and the steps you can take to control it before it controls you. Section 1. What is high blood pressure, really? Blood pressure is a measure of the force your heart uses to pump blood throughout your body. But when that force is consistently too high, your blood pressure is high, too. In simple terms, this means your heart is working overtime, putting strain on blood vessels and vital organs. Over time, this can lead to serious complications like heart disease and stroke. To break it down, systolic pressure is the pressure when your heart beats, pumping blood into the arteries. Diastolic pressure is the pressure when your heart rests between beats. When you get a blood pressure reading, it shows your systolic pressure over your diastolic pressure. For instance, if you see 120/80 mm Hg, it means 120 is your systolic pressure, and 80 is your diastolic. Section 2. When is blood pressure too high? Your blood pressure falls into one of 5 categories, and knowing which category you're in can help you understand your health risks. 1. Normal, systolic below 120, diastolic below 80, all good here. 2. Elevated, systolic between 120-129, diastolic below 80, consider this a yellow light. 3. Hypertension stage 1, systolic between 130-139 or diastolic between 80-89, high blood pressure is here. 4. Hypertension stage 2, systolic of 140 or higher, or diastolic of 90 or higher, now it's serious. 5. Hypertensive crisis, systolic above 180 or diastolic above 120, this is a medical emergency. High blood pressure doesn't play favorites. You may not feel any symptoms, but if left unchecked, it can lead to heart failure, kidney disease, vision loss, and stroke. It's like having a ticking time bomb inside your body, but with the right knowledge, you can defuse it. Section 3. Who's most at risk? Some people are more likely to develop high blood pressure, and understanding these risk factors can help you take preventive steps. 1. Age. Blood vessels naturally become less flexible with age, making older adults more susceptible. 2. Gender. Men under 65 are at a higher risk than women. 3. Weight. Carrying extra pounds means more blood is needed to supply oxygen and nutrients to your body, which raises blood pressure. 4. Pregnancy. Women can develop high blood pressure during pregnancy, particularly in conditions like preeclampsia, which can be dangerous to both mother and baby. Section 4. What causes high blood pressure? The causes of high blood pressure can be split into 2 types, controllable and uncontrollable. Uncontrollable factors, age and genetics play a big role. If your family has a history of hypertension, you're more likely to have it. Diabetes is another condition that can lead to higher blood pressure due to damaged blood vessels and the strain of extra blood sugar. Controllable factors, smoking and alcohol, both of these habits make it harder for blood vessels to relax, increasing your blood pressure. Diet and weight, foods high in salt can raise blood pressure, and excess weight puts more strain on your heart. Stress, constant stress triggers a fight or flight response, causing temporary spikes in blood pressure that can turn into long-term hypertension if the stress is frequent. Section 5. Monitoring and managing blood pressure. If you have high blood pressure, managing it is crucial. Here's how you can stay on top of it. 1. Measure regularly. Home monitors are affordable and easy to use. Check your pressure consistently, at the same time each day. 2. Lifestyle changes. Quit smoking, cut back on alcohol, reduce stress, and maintain a healthy weight. Each of these steps can lower blood pressure on their own. 3. Medication. Your doctor may prescribe medication that works by reducing the amount of salt and water in your body, relaxing your blood vessels, reducing the force of your heartbeat. Some people need multiple medications to manage their blood pressure. And if you're taking medication, consistency is key. Stick to the schedule to get the full benefit. Section 6. When to call for help. If your blood pressure suddenly rises to 180 out of 120 millimeters Hg or higher, you're in hypertensive crisis territory, and you need immediate medical help. In these situations, symptoms might include severe headaches, chest pain, shortness of breath, or changes in vision. Don't wait to see if it gets better. Call 911 or head to the emergency room. For pregnant women, signs of preeclampsia, like swelling, blurred vision, or severe headaches, require immediate medical attention. Monitoring blood pressure at home and keeping a regular check-in schedule with your healthcare provider can go a long way in staying safe. Section 7. The path to lower blood pressure. Even if you have high blood pressure, hope is not lost. Here are effective, long-term changes you can make to help lower your blood pressure. Eat a heart-healthy diet. Opt for fresh fruits, vegetables, whole grains, lean proteins, and foods low in salt. Exercise regularly. Get at least 150 minutes of moderate aerobic activity per week. Even a brisk walk each day can have big benefits. Sleep well. Poor sleep can contribute to high blood pressure. Aim for 7-8 hours of restful sleep each night. Remember, you're not just lowering a number on a screen. You're reducing your risk of heart attacks, strokes, and other dangerous complications. Every small change you make matters. Conclusion. High blood pressure is a serious but controllable condition. With regular monitoring, healthy lifestyle choices, and, if necessary, medication, you can take charge of your blood pressure and protect your heart. Imagine a future where you're in control, free from the silent strain of hypertension. Now is the time to start making changes. Take your health seriously, and take the first step toward a healthier you today. For more tips and insights, don't forget to subscribe to our channel and share this video with loved ones who might need to hear this message. Together, let's beat high blood pressure and live healthier lives. Thanks for watching, and stay tuned for more health advice.